Hello, I'm Sheila Davies, Director of the Dare County Department of Health and Human Services. I would like to provide you with updated information regarding COVID-19. The number of confirmed cases of COVID-19 in the nation and our state continues to grow. Currently, there are 137 confirmed cases in North Carolina in 28 counties, including Pasquotank County. No individuals in Dare County have tested positive for COVID-19 at this time. Currently, all but one case in North Carolina has been traced to travel or direct contact with someone who was tested positive. Yesterday, there was an individual in Wilson County whose virus could not be traced to travel or direct contact, which indicates the first case of community spread in our state. We have received questions about the readiness of our medical community, and we have reached out to the president of the Outer Banks Hospital to provide you an update.
Hello, I'm Ronnie Sloan, president of the Outer Banks Hospital and Medical Group. We've been collecting samples from patients and sending samples to either the state lab, LabCorp, or Quest for testing for COVID-19 for a few weeks now through our urgent care centers and emergency department. As the response to the outbreak evolves, so is our ability to get test results back more quickly. Since late last week, the Outer Banks Hospital and Medical Group leadership team has been working around the clock to prepare for COVID-19. We've made the transition from talking about testing to scenario planning in the event that we start to see community spread of the virus and people in our community in need of medical attention due to COVID-19. We've imposed visitor restrictions and screenings at our front doors to keep our patients and team members safe. We're also suspending most services that can wait a few weeks. We're asking patients and providers to think critically about what can wait. If your medical appointment can wait a few weeks, we'll be asking you to reschedule your appointment. In addition, our medical group is rolling out ways that we can provide care via FaceTime or video chat. All these temporary measures are to protect you from being out and about and putting yourself at risk. This also allows us to repurpose and cross-train some of our staff to be available to meet the needs of patients in the event that we experience a local surge of COVID-19 that requires medical care. Daily, we are planning for a potential surge. We're carefully reviewing our supplies, staffing, policies, procedures, capacity, and partnerships. The Outer Banks Hospital is part of a system of care, and we're partnering with regional resources to meet the needs of local patients. Our partners in providing medical care include Vidant Health, Chesapeake Regional Healthcare, and Centera. We're all in this together and will work together to get patients to the right level of care and do what's best for the community we serve. If there's one thing about this outbreak that I know for sure, is that there is much uncertainty and things are constantly evolving. Still, we're doing everything we can here locally and with our local and system partners to protect the public health and be ready for COVID-19. In closing, I join many others in encouraging you to adhere to the CDC's recommendations. Stay home, even if you're sick, if you can manage your symptoms at home. If you need medical care, the Outer Banks Hospital is here for you 24 hours a day, 7 days a week. Take good care of yourself and your family, and together we will get through this.
We are grateful for the partnership we have with the Outer Banks Hospital and area healthcare providers, who are all working together to protect the health of our community. One of the biggest threats with the spread of COVID-19 is overcrowding hospitals and medical providers, which could keep healthcare workers from taking care of the very sick and putting them at risk. While currently there are no individuals who have tested positive in Dare County, it is imperative that we all remain vigilant. To preserve public health and safety, everyone must use best practices for social distancing outlined by CDC and NCDHHS, and encourage your family, friends, coworkers, and neighbors to do the same. This includes staying at home as much as possible, avoid discretionary travel, and if you must go out, avoid crowded places. Put space between yourself and others, more than 6 feet whenever possible. I understand these uncertain times can lead to community members feeling anxious or fearful. As we move forward through this pandemic together, facts over fear is the best way we can all find comfort. We will continue to provide updates with factual information as we receive it, and we encourage you to stay informed by visiting www.darenc.com/COVID-19 or by visiting the CDC or NCDHHS websites. If you have specific needs or questions, you may also call the Dare County Call Center at 252-475-5008. Thank you.